So I think the word nexus comes from connection. So this particular nexus, I think, is finally our opportunity to intentionally connect our educational programs to our healthcare system. So to me, it's about finding connections that were kind of foreign to us as educational institutions or as healthcare institutions in the past. So I see this particular nexus as that opportunity to bridge all those connections. When you think about the way we used to practice, right, there was kind of a standard rubric, right? This profession did X, that other profession did Y, and we didn't really understand what created a happier, healthier patient or a less expensive healthcare system. So I see that these two approaches, interprofessional education, because the one thing we know about students is that they practice the way they were educated. So that is the rationale for the education part. The collaborative practice is about creating a better healthcare system for our patients. And I think for those of us who've been trying to implement these kinds of changes in very big systems, it is really important to link with other individuals and other groups who believe in this and who we can learn from. So the National Center provides that kind of resource in terms of authoritative resource. It provides a network to link to, and it provides really a group to get support from as we move forward in this really important endeavor.
My vision for healthcare transformation is really to move to a practice model that's about collaboration and that involves many different professionals, some that we would think about traditionally, some maybe less traditionally, moving away from a siloed care model where the patient goes from provider to provider and moving towards where you have really an interprofessional healthcare team and they take shared responsibility and they have shared goals, and that can really improve the outcome of the patient's health. Our project is called KCATS, so that stands for Kentucky Care Across Transitions for Stroke. And the idea is that if we have an interprofessional transition of care for stroke patients across the care continuum, that their healthcare will be more comprehensive. Really, I think can only have a positive impact. Stroke patients require lots of different professions and professionals to make sure that their care is comprehensive and complete. And if we could do that as in a model of collaboration and working together, then I think that the patient outcome, functional outcome, recovery will benefit. Having a Nexus initiative is really, I think, can have a very positive impact on my ability to care for stroke patients. The benefit of working with the National Center, I think, is, there's a huge benefit. I think probably the biggest benefit I'd see is the scalability. So any sort of one institution or one project or one initiative by itself can only scale to a certain size, but when we all collaborate with the National Center towards a common goal of IPE and IPCP, then we can really have a huge scalability to transform healthcare across the nation.
The idea of the nexus, I think, is very rich because academics are often, accused of the ivory tower, and sometimes there's a leading and sometimes there's a lagging. But to be part of the nexus is really about understanding what's going on more on a national level. For me, to be able to be a member of the nexus is to help refine some of our thought processes against some of the other participants in the nexus, to validate, are we seeing the same things you are? Are we perhaps a little off base because of some local phenomenon that we're experiencing that may not be generalizable? To be able to contribute that data to a larger data repository is simply going to amplify the ability to get a clear message out about how people working together in teams, be they teams of students or be they teams of already licensed providers, can improve the outcomes of care. I think some of the benefits of being part of the National Center is having some pretty smart people help shape and develop your thoughts.
For us at Pittsburgh, the Nexus really is that space between education and practice, and it's the place where we're able to innovate and really study what's happening by connecting those two entities or those two initiatives much more closely. So our 4 projects are focused on really looking at innovative practice models, and by doing that we're studying how the teams are functioning and what the individuals on those teams need to be able to do, and that's providing really rich information that we're able to feed back into and influence our curricula then across the health sciences. Benefits for students are that they're getting the most contemporary educational program that they possibly can, that they're really ready for the realities of contemporary practice. The benefits for our patients are that these models that are evolving on the practice side are truly aimed at providing optimal care that's timely, and it's accessible and at a decreased cost. And we're really getting people who are the best positioned to provide that care at the at the fullest extent of their training. So everybody benefits from that. Our program, our ability to connect education and practice and really study the nexus has been stimulated in large measure. Well, we were doing some of it before, but it's really been catapulted by our affiliation with the National Center, having access to the resources and the expertise both of the staff that are there as well as connection to the other incubator institutions. So we're learning and being able to deploy new things kind of as they become available and knowing to everybody.
My vision for healthcare transformation is about partnership-based care, relationship-based care. And in relationship and in partnership, it's person-centered. Faculty are involved, students are involved, the community is involved, the patients are involved in being able to contribute what needs to be there to be the change that we're hoping, and that change being to enhance patient outcomes, to improve health in our communities. For me, the Nexus is about creating those partnerships, creating essential partnerships through relationship to achieve the goals. The benefit of collaborating with the National Center is about being a part of this important movement, and it really is about moving towards and contributing towards a legacy of change. And even in that, moving beyond change to transformation.